1.
Good morning. I'm Renee Frankar with Cabinet Communications and the moderator for today's COVID-19 update. We are joined today by Premier Sandy Silver and Dr. Catherine Elliott, the Acting Chief Medical Officer of Health. Thank you to Mary Teason for our ASL interpretation and to André Bossier for our French translation. Following the remarks from our speakers, we will go to the media for a round of questions. I will call you by name and you'll each have 2 questions. Should time allow, we'll circle back for another round. Before we begin with our speakers, I would like to verify that everyone can hear us. If any reporters are having any issues, please email ecoinfo@yukon.ca. I will now hand it over to Premier Silver.
Thank you very much, Renee. And good morning, everyone. We are here on the traditional territory of the Kwanlin First Nation and the Ta'an-Quachin Council with Dr. Elliott, Mary, and Andre and the team. Last week, I spoke of the injustices that are happening to the people of Ukraine. Our government is donating $50,000 to the Canadian Red Cross to support humanitarian efforts in Ukraine and also neighboring countries in response to Russia's attack on Ukraine. I know Yukoners and all Canadians are appalled by the actions of Russia. We stand in solidarity with the people of Ukraine. We'll continue to work with our partners across the country to fast-track immigration of Ukrainians and to provide humanitarian aid and other supports. The strength and resolve of the Ukrainian people in the face of this unjustified aggression is truly powerful, and we will continue to support them. I'm deeply saddened that another Yukoner has died due to COVID, and I want to express my sincere condolences to the family and friends of this individual. Please know that our thoughts and prayers are with you. It has been, it's been nearly 2 years since Dr. Elliott and I first stood before a packed room of people to announce the cancellation of the 2020 Arctic Winter Games. Looking back, that was a very difficult decision, that's for sure. But it was the responsible decision, and it prevented an early outbreak of cases in the territory. We have had to make some very serious and difficult decisions every day since then to protect the health and safety of Yukoners. In the last 2 years, we've learned a lot. We've learned a lot as we navigate together through different phases of this pandemic, from the availability of vaccines at the start of 2021, which seems a lifetime ago, to different waves and variants, especially Delta in the fall, and of course, most recently, Omicron at the beginning of this year. It has not been easy. It has been incredible to see Yukoners coming together to support each other, to step up and to protect our friends, our neighbors, and our communities. And we have avoided the most serious, severe health and economic impacts of the pandemic because of this camaraderie and sense of community. We could not have done it without Yukoners getting vaccinated, Yukoners practicing the Safe 6, following the public health measures, supporting local businesses and organizations, and the leadership that has been shown by every community leader, local businesses, leaders in the local businesses, community organizations as well. It was so wonderful to see people gathering last weekend for rendezvous. Getting together after the dark and the cold and the isolation of winter, it has never been so important. After a long and difficult 2 years, 2022 is looking promising. We have moved past the peak of the Omicron wave, and thanks to the diligence of Yukoners, again following these public health measures, we have prevented our healthcare system from being overwhelmed. I want to thank all of our healthcare workers who have shown such dedication over the past 2 years. We would not be where we are without you. I cannot express how thankful we all are as Yukoners for your exemplary service. As I announced last week, this Friday we will be lifting nearly all of the remaining COVID-19 public health measures. Gatherings and events will no longer have capacity limits. Bars and restaurants can return to normal services. It's time to get your dancing shoes Again, we know that this is very welcome news to people right across the territory. As of March 4th, the only public health measures that will remain in place are the requirement to wear masks, the requirement to show proof of vaccination to access designated sites, and the vaccine requirements for public servants. We continue to be in a good position with health indicators trending in the right direction, and Dr. Elliott will have more to share about our current situation in just a moment. Today, I'm happy to share more about our plans for the upcoming weeks. Starting March 18th, we will be removing the requirement to wear masks in public indoor spaces. Wearing a mask will still be strongly recommended, particularly when people are in crowded or close quarters and where it is difficult to physically distance, but it will no longer be a requirement. I plan to keep on wearing my mask when I'm out shopping or heading to my table at a restaurant, and I'm sure I'm not alone in that. It's extremely important to keep in mind that private establishments have the right to request that their clients wear masks before entering a space. And we encourage everyone to respect the requests and any other health and safety protocols that are in place. Dr. Elliott and her team continue to work closely with the Department of Education to update guidance for schools as we move forward, so more information will be shared with schools later this week. Additionally, the requirement to show proof of vaccination to access designated sites will be lifted on March the 18th. Businesses and organizations can continue to require proof of vaccination if they so choose, and like masking, we urge all Yukoners to respect these safety protocols. We will continue to provide proof of vaccination certification for those who are fully vaccinated, and the Vaccine Verifier app will remain available for download. Dr. Elliott and I have spoken in the past about how public health measures are like speed limits. I borrowed the expression from her. They set the standards that must be followed, but it's still important to use your discretion, be responsible to the conditions, and act in a way that will keep you and everyone around you safe. As we look to adapt in the coming weeks, we need to continue to be kind and respectful of one another. We are all in this together, and we need to continue to support each other. Now, the last remaining public health measure is the vaccine requirement for employment. This requirement was introduced to ensure a safe working environment for our employees, including our healthcare workers, while protecting the health and safety of the members of the public that we serve each and every day, especially our most vulnerable populations. As the territory's largest employer, the government of Yukon has a duty to lead by example and to do our part to keep Yukoners safe. As of February the 15th, nearly 95% of our public service had attested to being fully vaccinated. I want to thank each and every one of these employees that have attested to their vaccine status. This vaccination requirement has been very effective in minimizing the spread of COVID-19 in our workplace and ensuring continuity of service delivery. Thank you. Thank you for helping to keep us all safe and our workplaces safe for employees, as well as those who are accessing our programs and services. The Delta and Omicron variants, they really tested our territory. We have responded with the community-minded spirit and resolve that makes this such a special place for all of us to call home. And for that, I'm extremely grateful. Employees that have not yet attested to vaccination requirements have been placed on leave without pay. This includes 95 permanent employees and 198 casual, on-call, and seasonal employees. We will continue to monitor the situation in the coming weeks, and if things go well, our plan is to lift this measure and allow many of these employees to return to work as of April the 4th. We are still working with Dr. Elliott and her team to evaluate and to assess some positions including those people who work in high-risk settings with vulnerable populations. Now, we will have more information to share with you in the coming weeks. I want to thank these individuals for their service. I know the last few months has been extremely difficult. The pandemic has been challenging for every single one of us. We have taken measures and measured approaches to the pandemic to protect the health and safety of Yukoners. It has not been easy, but our approach has proven to be very effective. We are fortunate that together we have avoided the most severe health and economic impacts. We would not be in this position if it were not for every Yukoner who stepped up, got their vaccines, practiced the Safe Six, and helped prevent the spread of COVID-19. Yukoners have been diligent. I'm extremely proud and humbled by how we pulled together in these recent weeks and months in spite of the many challenges that we've all faced. I know that there's been sacrifices as people have had to pivot and adapt. It has not been something that anyone wanted to have to do, and we don't want to do it again, but you all have stepped up. Thank you for keeping us safe. It really matters, and it really has made a difference. Vaccinations, they're still available, including the booster shots. Get your shots, please, folks. By doing so, you show your loved ones and those around you your care. And please remember to get boosted when it's time. It's especially important to keep your immunity strong and to prevent severe illness if you contract COVID-19. You can find this information again about appointments as well online at yukon.ca/thisisOurShot. Rapid tests are available in Whitehorse and in our communities. These are yet another tool in the toolbox to help you when we're making decisions when heading out the door. If you have any COVID-19 symptoms, no matter how mild, even a headache or a runny nose, please stay at home. It is these little actions that add up and help prevent the spread. As we continue to lift public health measures and get back to a sense of normal, we will be scaling back these live updates as well to once every 2 weeks. We'll continue to monitor the situation very closely, and you can find the most up-to-date information again online at yukon.ca. I want to thank everyone who's tuned in to listen today, and with that, I will hand it over to Dr. Elliott. Merci, Joe.
Merci, Joe. Premier Silver. Good morning. Bonjour. Donja. I'm pleased to join you on another beautiful spring day in Yukon. And as more public health measures are eased this Friday, I know it will be a welcome breath of fresh air for many. And it may feel like starting to get some of the things back that we have forgone in order to get through this past wave. But we need to remember to respect that people and businesses need to adjust each at their own speed. And we need to be patient, kind, and accepting of all the different choices that people will make. With spring break just around the corner, I'm going to talk a bit today about how to use your COVID sense. And this will help all of us enjoy a safe and well-deserved spring break. For some people, it will feel like things are taking a very long time to change back to fewer measures. And for others, it will be a frightening time, a time that builds anxiety as we change the ways that we've been protecting ourselves over the past few months through a back-to-back Delta wave followed by an Omicron wave. This is why everybody will make their own choices and why respect is so important right now. Here's what's happening around the territory today. There are currently 43 active cases in the territory, and there are 4 new cases. The most recent reports show that we've had 123 hospitalizations due to COVID-19 and a total of 21 deaths since the pandemic began. Yes, unfortunately, we have had another death, and my condolences go to the family of that person. Many people will wonder, well, where are we now? Here's where we are. We're over the crest. We've had a downslope, and we've stabilized at a moderate level of case activity. And throughout this time, we have made decisions in order to balance the harms and the benefits of the pandemic with those associated with the response. This is a part of the challenging work that Premier and I and our colleagues do together. Here are some of the ways that we have done that. We have had an overall clear goal to minimize severe illness and death, and also to minimize the outcomes or impacts of the pandemic on the population, including those of the measures that we have imposed. We've had another goal to avoid hospital strain and overwhelm. We have accomplished these things. The first thing I want to say is many people say, well, there's not that many hospitalizations. How could there be any strain? Here's where we've seen the strain. We got out early. We were proactive in this wave, and we did a number of things. We revised our schools' guidance, and we kept our schools open to in-person learning. We supported businesses and organizations and groups as they changed and adapted to the different measures. We never locked down. We kept businesses open. We kept schools open. And we each did our part by minimizing the number of contacts we each had while keeping these things going. We minimized the amount of time with the most stringent measures, and we've lifted logically and in a stepwise manner. All of this has taken a toll on our Yukon Communicable Disease Control staff, who have adapted to changing guidance and really responded effectively to the outbreaks that we've had in long-term care and in Whitehorse Correctional Centre, as well as a number of other situations where guidance was needed and supports were needed. The testing program has changed. We changed the guidance. We changed the locations, opening the testing in the Delta and maintaining that opening, the drive-through testing. And we also were able to offer the rapid antigen tests and offer this to people. We've put a lot of effort into communications and creating supports, new traffic light, new pages to explain the measures, and also these media briefings in order to make sure that you're informed and you have those supports. And the government has done a lot of work in supports, financial supports in different areas of strain, such as businesses or people who need to isolate and lose income because of that. We've also suffered some losses. Throughout the pandemic here, as well as in the rest of Canada, there has been an increase in use of substances, strain on mental health, people's mental health, and we have had more deaths this year from a health condition that we all know well, which is substance use disorder, than we've had in the past, particularly among those who use illicit drugs. These are the losses of the pandemic, and these do not go unnoticed, and there have been and will continue to be efforts to offer full supports in those areas. It's also why we need to look at where we've been, what measures we put in place, what diseases we have had and what we've averted in terms of our severe illness and death, and do our own homework, looking as an after-action piece of homework, which is part of any pandemic, and it's part of what we do in public health. One major harm right now that I need to talk about, because I think it's very important, is the divisiveness that we've seen in society. Never before have we known how connected we are globally. Think of any variant that's come, or the amount of travel that's changed and how those connections have changed. How we are within Canada. Think of the supports we've had and the ways we've worked with the federal government around rapid testing, case and contact management, and the many ways that we work across our governments. And locally. Think of all the ways, all the community organizations, local governments, First Nations governments, all of the elements of our society that have shifted and changed in order to support us all through this time. And also the ways that people have stopped transmitting COVID-19 to you, to your family, to those you love. Because despite all of this connectedness, we have also suffered divisiveness. And where we are seeing this right now is around behavior toward healthcare workers, threats or comments to leadership, and even, unfortunately, in school children and how they're bringing these arguments into the school. This is something we have to stop. We need to move forward and we need to heal together. We are all connected. We live in an incredible place where the right to free speech is very important, and we need to be sure that we do it responsibly and civilly and peacefully. So, what else do we need to do now? As we move forward with fewer public health measures, I encourage you to be wise in your choices, to make good choices, and accept the diversity and differences of other people's choices. It's important to connect with friends and loved ones and do the things that help us stay healthy, enjoy the arts, enjoy the wilderness. But we need to do so wisely in a way that won't put people at risk. So use your COVID sense. There still remains considerable transmission of COVID-19 in the community. This is a new variant of COVID-19. If you are fully vaccinated, your risk of hospitalization is extremely low. However, we want to keep the transmission at the level it's at. We're at a stable, moderate level, and we all have responsibility with this. I'm pleased that the measures will be lifted gradually, and also because having those legal tools is really the bottom line, the speed limit, as the Premier said. At the same time, we still need to live responsibly in community with each other. So as you plan what you're going to do, think about these things. Are you a vulnerable person, or will you be in contact with people who are vulnerable? Are you going to plan indoors event? And how big of a space? How much ventilation will there be? Or will it be outdoors? We know when we're crowded in closed spaces, even a person with mild symptoms or even no symptoms can transmit the virus. I encourage you to use ways to keep your activities lower risk, and use creative ways and post them on Facebook and share them so we can all learn from the different ways that we can keep ourselves healthy and safe. Find ways to explore your community, to enjoy your spring break, and to check out that new restaurant or art exhibit, to enjoy maybe going to a bakery or having a fire outside, or any of these things that we all enjoy, sports and arts, and just follow the Safe 6 when you feel like it's necessary. And you definitely are going to wear a mask up until the 18th of March, but if, after that, use your mask wisely. And accept that the caution of others. That means use your own COVID sense. If you know that it's likely that you're going to be gathering, many of us will be gathering with people outside of our own social circles that we've kept, especially in spring break. So this is about keeping, again, the types of contacts the lowest risk possible, and using the time and the place and the space to do so. If you're going to visit communities or events happening around the territory, let's be respectful of our neighbours. You can find the most up-to-date information for community travel advisories in the Council of Yukon First Nations website at cyfn.ca. If you're planning to travel out of territory, check the provincial websites where you're going. These measures are changing very rapidly, and you need to have a look and see what it is you're expected to do in the places you visit. Similarly, if you're traveling international, check out canada.ca and make sure you meet all the federal travel requirements. Whether you're traveling outside of territory, welcoming visitors here, or hanging out with people you haven't seen in a while, think about your risks and how to keep yourselves and others safe. Remember that if you follow these public health measures, that's what you need to do, and also be respectful of people's choices and those who go above and beyond what the measures are. Even though over time the vaccine requirement won't be in place everywhere, some people might not feel comfortable socializing with those who are vaccinated, or they might want to take extra measures. So feel comfortable to ask and to be asked. It's okay. We make different choices. Even if you're not needing to wear a mask in certain places, some people will choose to wear a mask. The Premier himself suggested some of the places he'll wear a mask, and I'll wear a mask when I'm mixing with people who I don't normally mix with or with people who are vulnerable. I like to think of it like this. When the weather's cold outside, we all choose different layers. Similarly, we'll choose different layers of protection as we move through this part of the pandemic. All of these types of choices are personal, and let's respect them. At the end of the day, you know what to do, and we'll continue to provide you with tools to support your choices. Remember, and this is really important, if you're feeling unwell or showing symptoms of COVID-19, please stay away from others and do a self-assessment. Check if you're a person who requires a PCR test. Are you someone who would like to do a rapid antigen test, or would you prefer just to lay low and have some quiet time while you recover? In closing, as we close today, I just want to remind you that as the public health measures are easing, we need to look at the dates and make sure that we follow them as they are stepwise lifting. And we also don't want to lose the momentum we've gained thanks to all of our hard work in this past month. And that's why it's so important to use your COVID sense. It's now more important than ever to think about these things. And we're all going to take these next few weeks and at our own pace. So please give each other the grace and remember to be kind. As the days continue to get longer, the sun shines into the evening and soon into the night. I hope you will get out and enjoy this well-deserved spring and soak up some of the time with your family, friends, and neighbors, and our whole community, which connects us all. Shonitan, Ganolshish, Masicho, thank you, merci.
Thank you, Dr. Elliott, and thank you, Premier Silver. We'll now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start, and please also remember to mute and unmute yourselves. We will go to the phone lines and start with Luke at CKRW.
Hi, thank you. This first question would be for Premier Silver. I know that these mandates are going to be lifted on March 18th, but the state of emergency will still be in place. And you mentioned that businesses can have their own right to request that you wear a mask or show proof of vaccination in certain settings. I'm wondering if that case, if somebody refuses to comply with the business's requests, can they still be subject to discipline under the Civil Emergency Measures Act?
Yeah, so once the Civil Emergency Measure Act ends, the answer would be no. And if we're lifting our provisions as of the 18th, well, then that's when we lift our provisions. Businesses can refuse access to their businesses to anybody based upon what they think is best. As I said, we will be in a position to lift the state of emergency, hopefully, in mid-March, if, along with the requirements for masks and the proof of vaccination, if health indicators continue to trend in the right direction. That's the direction we're going in. Remember as well, COVID's not over. There will be more variants, but right now, we believe we're in a situation, if we can cautiously move forward in the next 2 weeks to lift the civil emergency measures. If that measure is lifted, so would be the restrictions and the fines that come into the purview of that act.
Thank you. Luke, do you have a second question? Hello, Luke. Can you hear us? Do you have a second question? I'll circle back to you, Luke. We will move to Haley at Yukon News.
Hi, thank you. My first question had to do with the government vaccine mandate. I heard you, Premier Silver, say that considerations are still being talked about when it comes to high-risk settings like long-term care home. I was wondering if you could just clarify, do you mean that some workers may not be invited back, or that you'll implement testing requirements, for example, or different accommodations there?
Yeah, so We'll be working very closely with Dr. Elliott and her team on this. There's lots of details to sort out. We are evaluating and assessing some positions, including, and this is the most important piece, those who are working in high-risk settings with vulnerable people. So there's lots of different categories of folks that work in these fields, and ultimately health and safety is our most important goal as a public service provider. So we'll have more information to share in the next update. I think Dr. Henry said last week as well, if you work in healthcare and you're not vaccinated, it's probably the wrong profession for you. I think that those are very poignant words. So we'll be working out the details with Dr. Elliott and her team when it comes to evaluating these high-risk settings, with vulnerable people.
Yeah, thank you, Premier Silver. Just to add to that, I think one of the important things that
thank you.
People.
My second question, please, for Dr. Elliott. And
sorry,
I realize,
Haley.
We've had this conversation. There are no crystal balls when it comes to COVID-19.
Sorry.
Hey, Haley.
Yep.
Dr. Elliott's going to answer your first question as well.
I'm.
Okay, can you hear me? Yeah, good. Thank you, Premier Silver. And just to add to what Premier Silver has said, I think one of the things probably most of us have noticed during the pandemic, and many people may not have noticed before, is that there are certain settings where the measures are different. So when you go into a hospital, when you go into a physician's office or a healthcare center, when you get your vaccination or when you visit somebody in long-term care, the measures are generally higher than you would expect in a business. And this is because of the vulnerability of this setting. Similarly with vaccination, we need to be more cautious in these settings because people in hospital, people in certain healthcare settings and other settings are more vulnerable. Even if they've kept their vaccinations up to date, they're still at higher risk for severe disease. And so that is why we need to take more measures. So when we talk about lifting masks, for example, in indoor settings, this does not include healthcare settings. And there's a good reason for that. When we talk about vaccinations as we move forward, this is an important area where vaccinations will continue to be important. And these are the things that we need to do. As healthcare providers, we have a special privilege to provide health care to people, and we have an obligation that goes with that privilege. Sometimes it's working long hours, sometimes it's staying late, and sometimes it's ensuring that we've done everything we can not to bring disease into the workplace. This is what the Premier is getting at. Thank you.
Thank you. And Haley, your second question.
Thanks for that. My second question, as I was saying there, I know we can't predict everything when it comes to COVID-19, but we have seen in the territory state of emergency end and then come back along with restrictions. Dr. Elliott, can you comment at all? How confident are we that that might be the end of restrictions, or will they be coming back with
joining the meeting
right now?
Thank you, Haley. Thanks so much for that question. It's good news as we see we can lift measures carefully and gradually, and we can stabilize the case activity. This is good news. The variant we've had is very different from previous variants, very transmissible. Many people have become ill with COVID-19, and many people are infected right now with COVID-19 in the territory. And the blessing is that most of these illnesses are mild. And this means we've managed it differently. COVID-19 is a virus that adapts and varies and changes. We will see different variants. I don't know which pieces of the potential transmission, severity, vaccine effectiveness picture the next variant will have. What I do know is that we are watching this science like you wouldn't believe, and we will be prepared to turn on a dime. We've done it a lot of times, and we'll continue to do it. We use measures when we need to. We use the law when we need everybody to do something. And I'm happy that we're moving into a space where we don't need to do that. And the wiser we are, the wiser we all are, the more people get vaccinated, the safer we really are from the twists and turns of this pandemic. It takes every little bit and every person being wise to continue. And I think, it's a time to celebrate this change and this lifting, and to be aware that we don't know what's around the corner, but we know we can handle it. And that's how we work. Mm-hmm. Thanks.
Thank you. We'll now move to Tim at the Whitehorse Star.
Yes, good morning. First question would be either for the Premier or Dr. Elliott or both. Just wondering what the rationale for the a little bit more than 2-week gap in dropping masks and passports is when you've been working on a incremental weekly basis.
Yeah, it's a good question, Tim. It comes down to data, and we've had 3 weeks in a row of lifting provisions, and and this gives us the time that we need. As you lift a provision, it takes a while to see the effects of that data. And Dr. Elliott is constantly showing me different demographics, graphs, charts, and reactions to different measures. So it's cautious, but also at the same time, this is a big day. Like, this is really good news for Yukoners. We've been through a lot together, and we're very fortunate to be able to move forward.
Thank you. Tim, do you have a second question?
Yes, I do, and the second one is more for the Premier, I would think. With you poised to end the worst of the vaccine mandates, or the bulk of them for civil service employees, and these people expected to come back to work, are you expecting that they're going to be in a good mood?
It's hard for me to answer that question, Tim. I mean, you're talking about a whole bunch of different people from a whole bunch of different jobs. So I hope that folks, whether they were unvaccinated and didn't do the attestation, or folks that are in those employment settings, understand how important that vaccine mandate was, how effective it was as well. When Delta was here, and then Omicron, we put these measures in place. I believe October 15th was the first day. Since that day, we saw a huge increase in vaccination rates. 3,637 Yukoners received their first shot after that. 3,091 received their second shot. These are 8 and 7% of our population due to this mandate, for the most part. 18,989 people received their booster. 18,989. That's 44% of our population. This policy was necessary, and we're moving into a situation now, and we've always said from the beginning, this is a temporary public health measure.
Thank you. We'll now move to Anna at CBC.
Hi, so my first question is for Dr. Elliott. So I want to know what kind of capacity Yukon's healthcare system currently has to handle any additional waves, and how that factored into the decision to ease the restrictions in the territory. Thank you.
Thank you. Thank you so much for this question. Capacity in our system. The first thing is to define the system. So the system that responds to any wave of COVID-19 includes the public health system, medical officers of health here in Yukon and the Yukon Communicable Disease Control, our immunization group, which is a huge number of people, but largely led by community nursing and the immunization program. And of course, our testing system, our communications, government, etc. It also includes acute care in terms of our emergency departments and our hospital beds and ICU. The thing about Yukon is that our hospital system is small, and the same healthcare workers, the same physicians work in the acute care system as in the primary care system. So we're highly integrated. And nurses work across the system as well. If we need more people in immunization, there may be a need to have fewer people in other positions. This is really important to think about when you think about the capacity in our system. At this point, we have managed this 2 waves back to back with a tremendous effort among the initial response team, the SWAT team, maybe you could call them. This includes Yukon Communicable Disease Control, the immunization program and community nursing, the testing program, and a ton of legal and policy work in government as well as communications. We did all of this to avoid hospital overwhelm, and we succeeded. So that's good. But it's been a hard go for a lot of people, and making sure to maintain and take care of these human resources is really key right now. Whatever comes our way, we will respond. How resilient our workforce is will really depend on that care and ensuring that we take care of the people who have really gone the extra mile in the past few months. Thanks.
Thank you. Anna, do you have a second question?
Yeah, I do. I'm not sure who this is best for, so I'll just throw it out, and whoever can answer would be great. So we know that children under 5 are still not able to be vaccinated. So I want to know how the government is reconciling the easing of measures with the need to protect some of the most vulnerable citizens. Thank you.
Do you want me to start?
Yeah.
So the risk in children under 5, interesting question. I have children myself. I do have that parental as well as professional responsibility to protect children, and such an important part of our society and our future. COVID-19 in general has been a mild disease for children. Every time a new variant comes, we watch so closely to see, is this variant one that is more severe for children? The Omicron variant, thankfully, has not been a severe illness for children. It has, because of the number of children who have been infected, there have been more severe cases across Canada, and more children will have the rare long-term effect of long COVID. These are important considerations. At this point, we are at a stable case count and percent positivity that we can manage if we stay here. Vaccination will help children, especially those, of course, who have to keep their vaccinations up to date. And for those children who are under 5 and not yet eligible for vaccination, all of us are watching to hope this vaccine comes soon. And, parents may want to take extra protections. Many preschoolers and young children have been infected in this wave, and we have not had a case of severe illness in the territory amongst children in this wave. So things to keep in mind, and things that we continue to watch. We do have measures in daycares, in hospitals, and in healthcare facilities that will continue. And so these are some of the ways that we protect our children. Thank you.
I don't think I could add much more to that than what Dr. Elliott very clearly said, other than that our top priority for the last 2 years has always been to protect the health and safety of all Yukoners, and we're very, very fortunate. And comparatively to other jurisdictions, we've been very, very fortunate to prevent the most severe impacts of COVID-19, and we wouldn't be in this position without the combined efforts of Yukoners. But I think Dr. Elliott answered the question very, very well.
The one thing I will add is what parents and families and those around children, teachers, et cetera, can do is to be fully vaccinated and up to date on their vaccinations. They're less likely to get infected and less likely to transmit that infection. These are some of the other ways we can protect those little people. Thank you.
Thank you. We'll now move to Claudiane at Radio-Canada.
Oui, bonjour. Docteur Elliott, peut-être me redonner en français, comme d'habitude, juste les grandes lignes de l'annonce aujourd'hui, donc de nouveaux allègements, c'est ça?
So, Dr. Elliott, could you please repeat in French what are the highlights of your announcement today?
Oui, merci Claudiane. OK, d'accord. Les grandes lignes de l'annonce, c'est que nous sommes passés le crest du vague et puis nous avons descendu, nous avons arrivé à un nouveau plateau avec activité des cas qui est modérée alors, il y a encore de transmission communautaire, mais c'est à un niveau qu'on peut, on peut bien manager. Alors, le premier a annoncé des choses aujourd'hui et je vais... merci, oui. OK, bon. Depuis le 18 mars, nous allons arrêter l'obligation de porter une masque dans les espaces bien dedans ou dehors. Et c'est encore une recommandation de porter une masque, particulièrement où il y a beaucoup de gens, des endroits qui sont petits, crowded, et aussi si c'est difficile de prendre son distance. Eh bien, pour les gens qui sont vulnérables, où ils sont les gens vulnérables. Alors, on peut chacun faire notre propre choix. Aussi, pour les employés qui n'ont pas encore attesté de l'obligation d'être vaccinés, ils étaient placés en pas travailler et sans récompense monétaire. Et depuis si les choses continuent de descendre et qu'on peut arrêter la transmission comme maintenant, depuis le 4 avril, nous allons arrêter cette mesure et beaucoup de ces employés peuvent retourner à leurs emplois. Il y a des endroits où la vaccination est encore très importante, où il y a des gens vulnérables et ça, c'est les endroits du santé, par exemple. Et dans ces endroits, on va arriver avec des mesures pour la vaccination obligatoire. Le premier et moi, nous allons travailler ensemble pour ça. Pour les gens pour la mesure qu'on a la preuve de vaccination pour aller aux endroits, ça c'est aussi enlevé le 18 mars. Et alors, on va pas encore arrêter et montrer notre preuve de vaccination. Maintenant, nous sommes le 2 mars, alors en 2 jours, le 4 mars, les seules mesures publiques qui restent seront l'obligation de porter les masques, de montrer la preuve de vaccination pour les sites désignés et aussi la vaccination obligatoire. Et ça reste avec les changements que j'ai soulignés. Et toujours on regarde les indicateurs et on espère qu'on peut enlever comme ça. Merci.
Thank you. Une autre question, Claudienne?
Merci, oui. Donc, c'est-à-dire que on pourrait voir, certains parlent d'une 6e vague, de nouveaux variants, on pourrait devoir réintroduire des restrictions un jour, est-ce que vous pensez que ce sera encore plus difficile à ce moment-là de faire passer la pilule en quelque sorte aux résidents?
So, if I understand well, we can imagine that there might be another wave after that, and we might have to reinstall some of these measures. How difficult would it be to go back and reintroduce some of these measures if there was a need to reintroduce them?
Mm-hmm.
Yeah, I mean, this isn't our first wave. Every time, Claudienne, that we invoke new public health measures or take them away, it's extremely difficult. It's a lot of planning. a lot of logistics. That's just from the government side. I mean, the disruption to people in the communities as well. It's very difficult. So we don't take these measures lightly. But the good news is, after all these waves, Yukon has proven to be very versatile and able to quickly move forward to protect the health and safety of Yukoners. So I'm hoping that the next variant is extremely mild and months away. But we are ready. We're ready for what comes. And most importantly, Yukoners have done so much to prove their resilience in very, very trying times.
Oui, je peux ajouter un peu en français aussi. Si on regarde où on était en décembre, on avait le sens de nouveaux variants Omicron. Et nous avons fait beaucoup de choses pour préparer, même qu'on avait comme 2-3 semaines avant que c'est arrivé et une autre semaine peut-être avant que c'est augmenté. C'était difficile. Quand je recommande des mesures publiques, c'est difficile. Et même il y a 2 années maintenant, au commencement du pandémie, j'ai recommandé de quitter les guides, les Jeux arctiques. Ça, c'était très difficile. C'est un temps difficile avec les pertes et je donne une super énorme merci aux Yukonais qui ont resté avec nous, qui avaient suivi les mesures. On voit, si on regarde les vagues, on voit au Delta, quand on avait les mesures, les cas descendent. Et au Omicron, on avait employé des mesures et les cas sont descendus. Ça marche, mais c'est vraiment difficile. Utiliser les lois pour les mesures, c'est la dernière chose qu'on peut faire quand on voit que ça arrivera très mal si on ne le fait pas. Maintenant, on commence encore à arriver à un espace où on peut faire des choix. Chacun d'entre nous utiliser notre sagesse et faire des choix pour garder nous-mêmes, ce que nous aimons et aussi la communauté sauf et sain. Ça, c'est une chose de célébrer. Qu'est-ce qui arrive dans 1 mois, dans 6 mois? On ne sait pas. Je pense, moi, que à l'automne, ça peut-être va arriver avec une saison un peu plus difficile. Je ne sais pas comment, comme la grandeur, la taille de ça. Mais maintenant, c'est l'heure de célébrer ce qu'on a. Et je sais aussi qu'on continue à regarder. On continue à vous donner des informations si quelque chose de différent arrive. Nous avons prouvé que nous sommes au Yukon adaptables, nous sommes sages, nous pouvons nous protéger et être ensemble dans notre communauté. Et ça, c'est très important. Et ça me donne de confiance au futur. Merci.
Dr. Elliott, if I could have you repeat some of your answer for the reporters on the line in English. Summarize from the end.
Sure. I think one of the things I'm really grateful for here in Yukon is that you Yukoners, you've stuck with us through these tough times. It's been challenging. We don't like to use public health measures unless they're absolutely needed. I am so grateful for your resilience, for your creativity, for the ways that you found to make this work, and the ways you've stuck it out when it's been hard. I think those are the things that are going to be help us get through anything that comes our way, is staying together and helping each other and being wise. Thank you.
Thank you so much. I'll circle back to Luke one last time at CKRW. Luke, for your second question. Hearing nothing and seeing the time, that now concludes our COVID-19 update for today. Thank you to our speakers, to the media, to everyone who joined us watching live over Facebook. We appreciate it. Stay kind, stay safe, and have a wonderful Wednesday, everyone.